Hello, it's Dr. Gay from First Lake MRI, and this is a 59-year-old male with complaints of posterior thigh, buttock pain, just where the buttock and thigh come together. And on this axial view here we see the femur. So here's the yellow line corresponding to this image. As we go up to the femoral head, we see it right here. We come down to the greater trochanter out here on the outside. As we come down more inferior, we see this little bony protuberance here. This is the lesser trochanter. So the greater trochanter is up high. You feel it on the outside. The lesser trochanter is here on the inside. And the lesser trochanter we're going to see right here as this bony protuberance. Now there's another bone over here, the ischium. And here's the hamstring tendon origins. They look dark. This is the ischial tuberosity where it flares out and is wide here, where these attach. And we notice that there's a problem right here. There's a muscle called the quadratus femoris muscle. It goes right in between the lesser trochanter and the ischial tuberosity. Normally there's a pretty good space in between here, and in this patient the space is very narrow. We see the muscles getting flattened and compressed a little bit. So we call this ischiofemoral impingement. So the ischium and femur impinge upon this quadratus femoris muscle. Sometimes it'll cause the muscle to become atrophic or edematous. Sometimes it'll even cause it to bleed. But this is right in the area where they're having their symptoms. And we see this sometimes in patients who are asymptomatic or have other findings, so it may not be clinically relevant. But in this patient, where everything else looks very, very good, and this does correspond to the symptoms, this looks like a case of potential ischiofemoral impingement. Again, there's no edema of the muscle at this time. And that's it. Thank you very much.